Ms. Julia, in the context of patient health information, could you explain the key distinctions between data security and data privacy? How do these concepts uniquely impact healthcare?
Mhm. Well, that's actually an excellent question because security and privacy go hand in hand, but they're slightly different. And when security means how can we protect the data from somebody from outside reaching it, or somebody who shouldn't have access to it will reach it. Privacy is about how can we usually it's protecting against malicious access, right? Not necessarily, but a lot of times malicious access. Privacy is about how can we make sure that the record in question does not lead back to the patient. So, Nikki, in your case, hospital was another thing which should have been de-identified, because then the child would not be identified as easily. It often happens also for rare diseases, where it could be maybe only one patient per hospital. So even though the patient's name has not been discussed, because of the two factors, which is patient's illness and the hospital, it can uniquely identify them. So privacy is about how this information can be tracked back to the patient. And for example, when it comes to security in sending messages, especially when it's in one-on-one communication with the patient, then it's very important to make sure that the data, both at rest and in transit, is actually protected. But when, for example, we're talking about sharing data for research or creating the appeal, right, to support this child, that's where it's very important to have de-identification, because it's not the question of protecting data in transit. It's the question of that the receiving party should not be privy to whose patient are we talking about. So which patient are we talking about? So that would be the biggest difference.